Hi, my name's Jane Wardle and I'm one of the heads of course at the Medical Sonography program here at CQU. I also lecture into sonography as well, which I enjoy immensely. Well, the Medical Sonography program at CQU is the only one in Australia that's an undergrad pathway. So if there's a sonographer out there that hasn't been to CQU, they've got a postgraduate qualification, so they've had to do some other degree first, find themselves a training position, which is actually quite difficult, and then study for 2 years post-grad. So this is the first undergrad pathway, and so it gives you an opportunity to come into the profession without any background in medical imaging. So the program is 4 years. The very first year is pretty much all flexible learning and academic. So you'll spend a lot of time on anatomy, pathology, foundational ultrasound units, and it's all very flexible. You come in for a couple of red schools during that year, but there's a lot of theory behind that first year to give you a very good grounding, so that when you come into the second year, which you come into our labs for pretty much both semesters, and you'll start on your skills training within labs. And that is quite intense because you could possibly be in our labs here for 3 to 4 days a week. And you really do need to go from not knowing how to hold a probe to be able to scan an abdomen before you go out onto your first clinical placement at the end of second year. So the second year still has some academic units, so you'll be learning things that are very specific to abdominal ultrasound, musculoskeletal ultrasound and vascular ultrasound, at the same time as coming into labs quite a few days a week. At the end of the second year, you go out onto your first clinical placement for 5 weeks. And we have set you up there to have a very good basis of knowledge as well as scanning skills. And the first clinical placement is your opportunity to find out what it's like to scan real patients. And that can be quite different to our very controlled lab environment, but you will have the actual scanning skills to be able to start a scan and get the patient into the room and that type of thing. And then after your first clinical placement, you come back in third year for another semester of scanning skills and more academic units as well at the same time. So the second half of third year and almost the entire fourth year is clinical placement, because sonographers need a minimum of 2,000 hours clinical placement to actually become registered with the ASAR. So, and then while you're on clinical placement, you'll actually be doing academic units again. And in fourth year, you'll be doing your research units as well as going out onto placement, which is actually essentially working full-time in a clinical department. We have a very high concentration of tutors to students. And so you get to meet quite a wide range of sonographers while you come into labs here as well. And they will, we encourage them to tell students their stories about what it's been like for them to be a sonographer and tips and tricks about the actual scanning, but also, personal stories about their experience as a sonographer as well. So it's a great opportunity to get to know sonographers within actually the university. And then obviously as you go out onto clinical placement as well,